So in the emergency, we have a emerging trend as triage. So triage, it's a vast thing. So here we follow this Canadian triage acuity scale. So triage is based on severity and priority of patients. So this has to happen pre-hospital, where we see in the US or the European or the Gulf for the GCC. So all things happen in the ambulance, where majority of the stabilization of patients happen intra ambulance. For example, a stroke or a heart attack or some neck injury, stabilizing the neck or giving a loading doses, or patient's airway is compromised. So those airways patients can be tubed. There are two ways of tubing. One is LMA mask, they say, another is intubation. So intubation they don't do, but the emergency technicians will have every rights to tube the patient if they feel, once they are certified. Okay, so that rights will be there compared to nurses. Nurses are not privileged. Again, if someone has done a AHA, ACLS course, those kind of persons are privileged. But those who are doing the emergency technician, trauma technician course, they are more privileged without doing that AHA courses. So that is an added privilege. That's it. So when the triaging is done appropriately, before entering to the hospital only, the technician will decide which hospital this patient suits. So if someone is working on a national highway side and he has 2-3 hospitals to go, and which is the nearest is one thing, but where will this patient's neurological facilities, cardiac facilities or trauma facilities is in this hospital? Is it better suited to, or waste of time going to the smaller setup rather than going to a tertiary setup or multi-specialty? So that can be decided. So it's more of a vast knowledge where EMTs will pitch in to decide the prognosis or the prognosis of the patient's outcome. So it's one step above the nurse, I could say, and it's between the nurses and the doctors. So that's how this course is privileged, and more of machineries are taken care. Crash cards, the setup in the ambulance, the medications, preparations, the patient's monitor setup like ventilators, cardiac monitors, all these will be taken care by the medical care technician, emergency medical trauma technician. So a lot of scope into the current trend. What we say, the developed countries already have their setups, but for these steps, and India is one where we are seeing this trend nowadays. And I would say it has a lot of scope in this
Okay.
course.
So after graduating the BSc MET, Emergency Medical Care Technology,
Yeah.
they can get the placement as in Aster CMI.
Yes, of course.
So in all the branches or these branches only.
All the branches,
So
because
yeah.
Aster is very vast and we have our setups in GCC as well.
So how much they can expect to get a salary after getting graduated as a fresher?
As a fresher, definitely somewhere between 25 to 30.
30.
Yeah.
So after having the experiences, whether to work in India or Nepal or abroad, so which sector will be fruitful for them in
Of course,
terms?
it comes into healthcare sector.
Yeah.
The like opportunity is vast.
Mm-hmm.
So as we say, like airports, the cruise ships, hospitals, of course, and you can go into the government sector. Like a lot of governments in India, for example, they set up a trauma setup for the national highways, or air ambulance is a emerging trend now. So majority are avoiding land for a quick transfer of patients. So wherever, like for example, we get patients from North India to here, or sometimes Dubai to here. So these transfers happen through air. So definitely you need a like technical person who knows about the medical part as well as awareness on the shifting protocols. Nurses are most probably are fixed into emergency thing, but in
Not sure
emergency,
about the
yeah,
transportation and shifting things.
yeah.
So what is the makes difference between the EMT and nurses actually in terms of working and position?
nursing is most confined to the bedside most of the
Yeah.
time. This is you have extra opportunity to go out and work in the emergency. Especially the emergency technicians will be supporting the critical areas only. If you are working in the hospital sector, either the ICUs or emergency, majority is emergency only. So they will be supporting the emergency, stabilized patients, stabilize the patient, and they go back to the another pickup or something, this kind of thing. And ambulance services, definitely ambulance services.
So the student who have graduated the EMT have the both opportunity to work inside the ICU and also for the pre-hospital
Yeah,
things.
critical cares, I say.
So
Yeah.
both opportunity that nurses, what or opportunity nurses is getting, they will be getting the same
Yeah.
opportunity inside the hospital.
Yeah. ICU, why do I say is there are some shift outs happening from ICU to other hospitals. So then you need again a technician, other country or other hospital. So that time it's airlifting or ambulance transfers. This all can be taken care.
Okay, thank you so much, Nobel sir, for
Thank
your
you.
information. If you are willing to study Bachelor of Medical Care Technology, please contact us to study in Aster CMI Hospital. Thank you.